Dr. Denise Ejoh, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Very much for another day. It's another day, it's another time, and there we are again. So good morning and welcome to another edition of the Kakaki Cancer Awareness. Dr. Denise Ejoh, CEO of Cornwall Cancer Foundation, in partnership with AIT. AIT, thank you very much. And to my guests, good morning and welcome to today. Hope you have had a fantastic week. I think we've all been very busy with World Cancer Day, right?
Yeah.
Yeah, thank you. And to our sponsors, I want to say thank you for ensuring this program is sustained even in this season. We appreciate the leadership and commitment of AIT to ensuring this continues to get done. So I'll say together we fight, together we win. You can always find Cornwall Cancer Foundation on all your social media pages. Today, what are we talking about? The roles of the advocates. Advocates take the forefront in driving a changing story. There they are, the advocates, those that have been there, those that are sitting on it. I want to thank you both for joining me in your various capacities as we have a good discussion on what we want to achieve. So briefly, who am I and who am I talking to this morning? I am talking firstly to Tolu. Tolu, I need to introduce you this morning, and I am introducing you. Tolulope is a public health professional with over 7 years experience in programs management within the non-profit healthcare space. She's currently the programs coordinator of the Foundation for Cancer Care. Thank you and welcome to this program. Thank you, Tolu, for joining me. Can you please let us
know? Thank you for having us.
I was hoping that you would say that, because if you didn't say that, that would have been very difficult for me. And next, we've got Gloria. Gloria is a cancer survivor. You're looking very fresh. You see now, when you're telling me I'm looking fresh, can you not see cancer people? They can still look fresh. You can still look fresh. All right, then. Gloria is a 12-year-old cancer survivor. She's also a patient advocate for better care in Nigeria. She believes that we can do better if we join hands together and push for policies that will be favorable to the Nigerian cancer patient. As a patient, she believes we can have a good life within and after cancer. Thank you both ladies for joining me this morning, and thank you for what we're going to be talking about. So let's get it moving now. Patient advocates. So I'm going to separate both of you, patient advocates and our general advocates, yeah? And let's go from that. So I'm starting with the patient advocate. Patient advocates are a part of the stakeholders as opposed to having a part of stakeholders as opposed to having a seat, as opposed to having to force a seat on the table. Does that make sense? Do you both get that?
Yes.
All right, thank you. I just wanted to make sure because I started it all wobbly. Okay, so the World Cancer Day was celebrated by our government on Monday, the 6th of February. What are your thoughts about the events as it focused on the medical community? I didn't really pick us up, apart from the NCS and every various advocate groups. The announcements and everything focused on equipment, the launching of the breaker machines. What of the human beings? That's where I'm coming from. Gloria.
Thanks, Dr. Denise. I think I like where you started from. In 2018, when I attended, there's a forum I attended, and surprisingly, there was data of the number of radiotherapy machines in the country the number of radiologists, oncologists, hospitals, numbers of everything. And do you know what was like? There was no data on patient survivorship. So I'm not surprised it's coming up because I have this feeling that what we have been doing since over 5 brachytherapy machines. And I don't know how we're going to go from there. Hello, can you hear me?
I can hear you. Go on. Go on. Go on.
So I'm not surprised it's happening. I'll be surprised if there's a change. I don't like sounding pessimistic. But I've realized that in the course of advocacy, people see you as if you're disturbing them. And if you're disturbing them, it means that they're not ready to change. And that is the problem that we are having. It's not okay. It's more about the equipment. It's more about the doctors. I'm not against the doctors because they are there for us. But what about the patients themselves? Things are hardly focused on the patient. In fact, maybe we are just called once in a while by an NGO, oh, come and do something, let them know that there are patients there, and after that, everything dies down. Most time it is just as if it is an afterthought. So I'm not surprised that the World Cancer Day of 2023, that has the theme of closing the care gap, we are talking about mission, the ministry. So,
I actually am very mindful because one of the things I really struggle with is the fact that we are just very, very, very concerning. Let's continue. We'll come back on this because that when I saw it, I was like, no, I'm going to ask about this because we need to agree to start talking about it. Together, we're going to have to make our voices heard. We don't have a choice. And we can't continue to live on other people's voices. Tolu, you are an advocate. So community engagement and the role of the advocates. You see, as we were patient advocates and you're an advocate, and we really appreciate you guys because you must have some compassion for us to actually want to be part of our community and understand and drive the pain because I know that you also go home crying once in a while and that's just human. So training and involvement of community engagement as a driving force behind awareness and education is pivotal. We'll all agree with that. And that's, I think, why we do the awareness. So how or what strategies would you say can be used to internalize these issues? And when I say internalize, I'm trying to narrow it down to, even if it's small, let's narrow it, let's keep it in the community first before we start going further.
Okay. Thank you very much, Dr. Dennis. Thank you for having me once again. So I would like to say that as advocates, for cancer-related issues, we can be very passionate about spreading information, education and awareness, to people who probably don't have this information. And one of the key things is, as we carry out this community engagement, getting the stakeholders actually involved in this education. So when we get key stakeholders involved, when we're able to get the community to take ownership of our education, passing this information across, makes it easy for the information to actually spread. Because when you're no longer in that space, they're able to take it up and continue to spread the information about cancer prevention, cancer screening, and all of that. So I will give an example, about actually involving the key stakeholders. So the foundation, we coordinate a support group for cancer patients. And one of the things that we found out was, when you just come up with programs or initiatives that you feel will be beneficial to them, but you don't get them involved in the process of actually coming up with these initiatives, they don't seem to benefit as much, and you don't have as much success. So one of the things that we do, in the support group is to make sure that our cancer survivors are actually involved in the planning process. So we have like representatives of the survivors who actually, we all come together and plan. So we take the stance of, coordinating and just giving oversight while they tell us, okay, these are our pain points. These are some of the things that we want. These are some of the ways that you can actually support us. So it's very, very important that as advocates, we ensure that community engagement is a part of it, and we start from the grassroots. So I would give another example. Last year, we had a mammogram drive for 400 women, and we wanted to go to the marketplaces, to start from these people that actually don't have access to this information. So we wanted to reach out to market women specifically. And so we went to one of the markets and tried to get the head of the market, the Babaloja, and all of them involved in the process so that we can gain entry. But, even after explaining to them, we had like pullback from them because they wanted us to pay. We had to give them something to be able to bring a mammogram bus to that point and to be able to give the people in their community free screening. So at the end of the day, we were not able to have that particular screening because of this pullback and demands for funds. But the truth is that we need to be able to understand that different communities are peculiar, understand their needs, try to engage them, because the truth is that because we were not able to pay, the women in that community did not benefit from that screening efforts. So that is one community. And going forward, what we did was to work with the healthcare centers who already interact with these marketplaces. And, by doing that, it was easier for us to actually gain access to these market women. So, basically, I feel like we must always get stakeholders involved, the healthcare centers, get them involved, the people themselves. What are their needs? What do they want to know? What do they have access to? What don't they have access to? And not just impose programs on them. So I think that, that's really, really important for us as advocates.
Okay, thank you very much. I'm going to say something very quickly because that is actually what Gloria does. Funnily enough, she actually has also got what do you call it? A patient group. I'm correct, aren't I?
Correct.
Sorry. Yes, Gloria. Yes, Gloria. You have one as well, don't you? You run one as well.
I am heading one. Yes.
Okay, she heads one. I don't know all this English. Don't worry about it. Yes, she heads one. Thank you very much. And another thing I would like to say, it's very interesting what you just said, because I have just joined one and they gave us the classes and I was like, what are you even talking about? These are not our issues now. They're even deciding how we're going to work it. It doesn't work like that. I'm going to ask you both one sentence, quick points. I want you to answer this question and I want you to listen to the statement that comes with it. I've asked different sets of literate, semi-literate, and illiterate people, what is chemo? And the answer ranges from hospitalization, it kills, it's a no-go area. It's just very strange that has become the question. So I'm going to ask you both to give me one sentence that just educates everybody about what chemo is, so that at least when we start discussing chemo in our programs coming up, people will get a better understanding of chemo and stop running away from it. Gloria, go on for that one, please. And it's one sentence.
Chemo in the simplest terms is drug for the treatment of cancer. It kills cancer cells and it doesn't kill.
Thank you. Correct. It does not kill you. Thank you. Please, everybody hear that. Chemo does not kill you. It makes other organs go wrong, but it does not kill you. All right, Tolu, you tell us. Okay, the same question.
So I would say that chemo, she has defined chemo. So chemo, like any other drug, has side effects. Malaria drugs have side effects. So chemo drugs have side effects. So the fact that you're experiencing side effects from chemo does not mean it is killing you. It is just side effects. And some people have the side effects, some others don't. But it is treatment that would help you, come out of cancer or improve the quality of your life when you go through cancer. Sorry, I said more than one statement.
No, thank you. But you've answered that question. Based on it, from my perspective, I'd like to say yes. Chemo is one thing that we all have to recognize. it can come in very many forms. So we're getting 3 points out. It can form as an injection, as a tablet, or as a drip. You do not get hospitalized for having chemo unless you are sick from other diseases. I hope this morning you've all learned, even if it's something very quick and very short this morning. We're going to have to end it at this point today, and we're going to come back to this conversation. And I'm bringing these two ladies back on because I think we need to really retrash this thing out. I want to thank AIT for allowing us to have this opportunity to take this program forward. And I want to say to everybody, thank you for joining us. Thank you for your continued support. You can join us on, you can follow us on any of our social media platforms and join in the activities. Talk to people, encourage cancer patients, encourage your family and friends who are going through this, and tell them there's a lot of information out there. They can reach out to both of my visitors. They both have websites. They both have their own spaces, and you'll find that as the information goes on. Both of them are fantastic ladies who are powerful women in this space. Thank you all for listening to us this morning, and we look forward to seeing you all again in 2 weeks' time. Have a lovely day.
You too. Thank